really important question because it's something that I see a lot of every single day. I dissolve a lot of filler, and some patients it's actually older than a decade. And it's really unclear to us whether some of these hyaluronic acid fillers that people are putting in their face, whether they really do truly dissolve or if they just shift and potentially cause other issues such as lymphatic blockage. Sometimes, especially underneath the eye, for example, it could cause lymphatic blockage, which could exist for years and years and years for some patients. So I want to go through that process, and I'll talk a little bit about what I do for patients with filler and how I dissolve it, usually using ultrasound, for especially if it's a case where we have to make sure that we're using the right layers of or I should say we're targeting the right layers of filler pockets. Really, actually, it's a pretty fun procedure for me. I can go right in with ultrasound directly at the little filler bubble and just dissolve it directly there. So it's actually really nice for me. But I'm going to put that little text up there right now, and so you guys can see for yourselves whether filler does dissolve or not. We'll kind of go through and see also what filler options can be the best for depending on your skin concerns or your volume loss. I'm just going to fix this text. It's huge right now. Let's see if I could do that. And then we'll go through everything else. Hi, everybody. How's it going? Thanks for joining us today. I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. And I'll wait for some more people to show up, and we'll kind of go through just everything with this subject. And then also just any other subject you guys want to do. We'll go through everything here. But yes, does filler ever dissolve? It's a really good question because it's like so often I have patients who are told that what is happening with their skin is actually due to the fact that they're getting older and it's not due to filler, things like that. But the truth is that actually a lot of times we discover that there is filler pockets underneath there and they really needed to get it removed. And so I use an ultrasound a lot of times to actually go target that. And it works incredibly well for patients, especially the ones that had, under eye tear trough filler a few years ago. It's been like an epidemic, I found, where people were doing it like in the late 2000s, like I should say 2010s, and then early 2020s. A lot of people were doing under eye filler, and it ended up basically blocking the lymphatic system, which ended up causing this swelling, something called malar edema. And they're told really that they need surgery, things like that, but actually removing the filler could be one of the big things that can help out patients, because now we could end up and allow the tissue to contract without that lymphatic blockage, without that stretching. We have something that's basically pulling in water, it's hydrophilic, and it could end up being something that stretches out skin as well, especially if it's in the wrong area. So these things, like I think it's really important actually to sort of just pay attention to, because it's if you had filler at one point and now you think that you're aging, it's possible that you just have to remove that filler. That's what it's possible that you have to remove it. Let's see here. I know a few questions here. Serena, good evening to you too. How's it going? Hope you're doing well. Let's see here. What eye cream would you recommend for pigmentation around the eyes? So a little bit like just still on the orbital bone. A nice idea is actually Eucerin's anti-pigment cream. It's a really good option for pigmentation there. Just make sure it doesn't go in your eyes. So sometimes you could do it potentially in the morning with sunblock. A lot of people will get concerned with that, but really I think most people are going to be careful making sure it doesn't rub into their eye. So as long as you're not rubbing it into your eye, it's really a nice option for a lot of patients there. Let's see here. Do you believe in forma facials or any sort of radio frequency to tighten lower face and jawline? Lower face is okay. I'm not really a fan of necessarily doing that type of thing around the eyes. I actually don't use much heat or energy around the eyes in general. Lower face jowls, if you have that, if you have a little bit of fat right there, I think it's a great idea for. Period is saying, you seem like a very nice doctor. May God help you succeed. Thank you so much. Appreciate you. Smooth threads. What are your thoughts for a 24-year-old? What are you trying to solve with that? I think it's okay for some things like tiny little lines and wrinkles. It could help with that. I do like it for that. I think it's better than barbed threads for that kind of thing. But it sort of depends on what you're trying to solve with your, with your skin, especially at 24 years old. H is saying, does clindamycin reduce oil production? No, it's an antimicrobial, it's an topical antibiotic. It's going to help with the bacterial formation that occurs on your skin. It's going to help reduce that, but it's not actually going to help with the process of actual oil production, really. It's just the consequence of oil production, which is that you could get some bacteria that forms on there, and clindamycin can help wipe that away. User 71 saying, what's your favorite radio frequency treatment that doesn't cause unwanted fat loss? I think all of them have the potential for doing that, but it depends on who you're going to and how much energy they're using. So it depends on how much heat they're using when they're doing it, what layers of the skin they're doing it. Some people do go too aggressive with it. They shouldn't really be using radio frequency in their practice the way they do, because it's too aggressive. How does it enter lymphatic? Does that indicate it was done improperly? Well, the thing is that if it's, for example, around the eye area, when you're smiling, you're essentially sometimes can push that filler more superficial, and it's a hydrophilic product, so it's drawing in water. And as it's drawing in water, it could actually potentially block some of the lymphatic system, especially in sensitive areas such as underneath the eyes. And if you have anything where you have allergies, for example, that could be compounded because of that. Let's see here. Mario is saying, can you see my question? Mario, where is your question? I think I missed your question. I don't think I see it. Joshua is saying, just join. What was the answer to do fillers ever dissolve? Actually, so in some certain pockets, I think it remains to be seen if some fillers do actually truly dissolve. So sometimes when it's more superficial, I've had it for 12 years or so, where patients were complaining that there was some swelling over there. You look under ultrasound and there's some filler. You remove that filler in really nice strategic spots, and now it's gone, and then their swelling improves. Everything looks better. So it's pretty clear that was causing a physiological issue there. Now, how long it needs, how long it can last, I'm not sure. I don't think anybody really has the answer for it. They never really studied this for long term to see if fillers really last. The way I do filler, though, is I go really more structurally. I go deep to the bone. If we're going to do any blending type of approach, there's a way to do that with a cannula, but it's very, very small little bits of that. I don't usually do it like where we do big chunks superficially the way some people do. What's the best way to dissolve? How do we know if it's there? Well, like I did today, it was a really cool case. She didn't actually let me share the result there, but it was really, really cool because I went directly in the filler pockets with an ultrasound. So you can see the little filler pockets with the ultrasound, go with the cannula or with the needle, and just go directly at those. For some of those ones, sometimes it's more integrated with the tissue, it could be a little more of a challenge. But underneath the eye, sometimes there's little bubbles there of filler. Just go directly at it, and there's immediate improvement there. Let's see. Kay is saying, what's a good treatment for smile lines at 24-year-old and 11 lines? So for 11s, really the best thing at 24 years old is going to be some sort of neurotoxin. I use Dysport. People use Botox. You could do something like that to help prevent the contraction. For smile lines, it depends on really if it's true smile lines. And if you really do have like volume loss that needs filler. I do filler really carefully in that area. I actually prefer, one of my favorite products in that area is Belafil, but small little droplets of it. That's what works out really well for you. Kimberly's saying, how many sessions of filler migration for someone who's had filler for years? Well, it could just be one. It depends on what product was used and the area that we're doing it and how much was used really for that. Let's see here. Cologne is saying, Dr. Qazi, how much does a full acne treatment cost, subcision, laser, TCA? Most patients spend between $5,000 to $7,000 for their scars, most patients. And future sessions, especially lasers, TCA cross, after you do a combination session, future sessions are up to 55% off. Francesca saying, does silicone scar tape actually work? Just had surgery and worried about scarring. Yes, it's awesome. I do tons of silicone scar tape. I love it. It's awesome. LFN is saying, do you recommend Elicor for someone who has sensitive skin and acne scars? Nothing really shows that Elicor is going to really help too much for acne scars, at least at this point that I've seen. I've asked them for new updated things. I haven't really found any results that I could really push and say that Elicor is superior to just regular excision. Let's see here. Cologne is saying the price is not bad. Yeah, I mean, I really think that based on the amount of work and the amount of effort that I put in there, it's a very, very fair product there. Snowflake is saying, how do you decide on Belafil versus hyperdilute Radiesse for acne scars? Good question. So more like discrete pockets of volume loss, like it's in the temple area. I think Bellafold works incredibly well for those areas, or just little small areas that are on the face. Bellafold could work really well. If you want more like skin tightening, there's an issue sometimes where some patients, because they stretch out the skin so much from their scars, they had tethered bonds over there. There was pulled skin, and that stretched out the skin. So something like Radiesse could work really well for that purpose. Hi, Joey. How's it going? Let's see here. Kimberly saying, is 4 valves a lot of filler migration and removal? Not necessarily. Sometimes we do need it. Just depends on how much filler you have. So like I said, when we do it with the ultrasound, we take a look and see also. And I give you an estimate for that. But sometimes we have to come back a few times to dissolve it because there's a little bit more inflammation there. User 71 saying, what's your favorite treatment to tighten jawline and for pre-jowls? So if it's relatively mild, like you're saying, then one of the best options is actually going to be something like Face Tight. That works incredibly well. Face Tight, Neck Tight. You can also do something like Renuvion. All good options there to go internally, heat the skin, contract the tissue. You will get a little bit more of skin contraction that way than almost anything else that's currently on the market. So it's really, really nice for that purpose. But for patients who have like full true laxity and the muscles really pulling down, you probably need more surgery. If it's just some volume loss, then you could do something like Bellafold could be a good idea, or some sort of other products that stimulate collagen and can support the tissue there. Let's see here. Sculptra. Kim is saying, Sculptra, I hate that stuff. Why do you hate Sculptra, Kim? Lovely saying, does filler ever dissolve? That's a good question. That's what I'm wondering. I'm not sure. I don't think that it really does in some superficial pockets. I think deep pockets of filler, there's evidence that it does. I think like around the bone, it dissolves. That's typically how I do it, around the bone. But otherwise, I don't really know if it does. I don't think that anyone really shows that. Farah Fox is saying, odd question. It's not odd, but can you do anything for segmental vitiligo and restoring pigment in some areas? Currently, I think it's really limited. I don't currently have an excimer laser. It may be something I could pick up. That could potentially help. There's also something where we could do melanocyte transfer. I'll go into more with hypopigmentation next year. It'll be something I could try to push. But, to be honest with you, I don't know if we really have the best options other than excimer, which could be tedious for patients to come, weekly really for that. So it may not be, the most, I should say the easiest solution for some patients, but it may also be sometimes the only solution for more resistant cases. So, and it works ultimately. It's just, you have to be patient and just have to keep on doing it there. Let's see. Neha is saying chemical peel, good to do. So it depends what you're trying to solve. For pigmentation, it could help out. It doesn't help so much for scars though. Renata is saying, sir, my doctor suggested me to do a thread lift and fat graft subcision for my acne scars. That's not a bad combination, honestly. It's just, I don't particularly love threads per se for scars, but it's okay. I don't think it's bad to pull on the skin. And if you feel like that pulling actually does help with the scars, that may be okay. Sometimes I do think that there may be more risk involved than it's worth. There's, potential, especially you said that your wedding is coming up soon. So I would sometimes worry about lumps and bumps that you may not be able to resolve actually as easily as other things. Renata saying, have you tried both combination? Yes. So I do, I should say I used to do more of it. I don't do as much threads anymore because in my area, there was somebody that was doing a ton of it. I was dealing a lot with the complications, and I was actually doing subcision for these patients. And they weren't doing subcision, things like that to fix it. But it's like complex stuff to fix some of these threads, to be honest with you. And you have to sometimes use some tools to really pull out the threads. And so it's not something I really pushed for a lot of patients, unless it's a really perfect candidate. Cal Ray is saying, doctor, I'm seeing you tomorrow for a virtual consultation. So I said, awesome. Did you send in the photos, everything like that? So by the way, guys, we do virtual consultations, a ton of them every single day. It works out perfectly well. I had 2 patients that flew in from out of state today, and I do a lot with it. Essentially, we go through the case, we'll go through each of your individual scars, come up with a really good, robust program. Just show some photos for me. I'll be able to help you. And if your photos aren't the best, I will show you ways when we're doing the virtual, you'll have some light that'll shine on your skin, and I'll show you basically under that angle lighting what kind of scars you have and how I'll treat it. So it's really almost never a surprise when you come in. We're going to be able to come up with it. If there's something that I say, well, I may take a look to see if I should do an excision, things like that, I'll let you know. Sometimes I just say, I'm not so sure about adding this right now. I'll take a look. And a lot of times I don't have to. Honestly, it's exactly what we thought. Dibba saying, what fillers should I get? Well, Dibba, what's the problem there? What do you have? Where's the volume loss? And then we could take a look. Andrew Ramos is saying, do you do CO2 laser on the eyelids as well? Yes, we do. I do actually a lot of times more with the erbium laser for patients with Fitzpatrick 4 and above. So more like Hispanic patients, Asian patients who don't want to cause too much pigmentation issue. I usually would use more of the erbium laser for that. Let's see here. Any new treatment for rosacea? Well, there's a few different options. Of course, you typically want to do more with like antimicrobials. You do something like a XLV, V-beam. Those could help as well for the broken capillaries. But there's a few different options, but it's sort of like this ongoing process. The most important thing is going to do to avoid things that are going to trigger your rosacea. So things like alcohol, spicy food, those are all options. And really we want to make sure that we are limiting everything that triggers it before we jump into doing certain treatments. Jasura is saying, is filler the best and only solution to volume loss? Well, it depends. If you have really a lot of volume loss, like big indented areas where there's a lot of fat loss, then maybe fat transfer is a good option. We could potentially do a fat transfer. It just depends on how much volume loss there is. But filler, yes, it could actually help with that. Otrober is saying, does a cure permanently cure jawline acne that is occasional in a male? Well, it's certainly been improved for 2 years at least, and really similar to Accutane, like, essentially where after 2 years, it really is going to be less chance of it. But, just like Accutane, I myself also was on Accutane 3 times. Sometimes you did get a little bit of acne afterwards. And what we do at our practice is future sessions of a cure after you do your combinations of 3 or 4, then future sessions are up to 55% off, just so you know. So it's there just in case your hormones fluctuate, something else is happening in your life, and that happens. So Josh is saying, how far in the future do you think will acne scar treatments be so good that all scars can be 100% returned back to normal skin? And maybe we're going to get there. I'm not sure. It's tough to say. I don't know. There's a few different drugs that are coming out that it could be really, really cool if we could be able to showcase that they could get, as close to scarless healing as possible, maybe. I've tried looked at almost everything else. I don't really think that there's much improvement with like stem cells, things like that, to be honest with you. I don't really use like PRP for scars other than potentially for patients just to help for healing. So I don't really think there's much with those, but there's certain drugs, potentially even like verporphin could be an idea after excision. That could be an idea that could end up solving scars one day. We'll see. Let's see here. I know I missed a few things here, but am I crazy for getting Dysport on my forehead, glabella, and then Botox everywhere else? Well, why would you do that? I'm not sure. It depends. If you have a reason to do it, I guess it's fine, but I'm not sure why you would do that. Let's see here. What's a good lip filler for a slight, very unnoticeable difference, slight plump pump? Well, Restylane Refine will give you very slight lips. It's going to not last you for too long. I think Kiss you could do really like that too. It just depends on how you're placing it. Just go really soft, and that can end up working out for you. Jasper is saying, I did Altera and Dermage in Korea that really slimmed my face. I want to restore fat volume. So what you may do is actually something like hyperdilute Radiesse, which works really well. And so that could be a good idea to actually slowly improve loss of volume from products like Altera or Dermage. I deal a lot with that. It's very, very popular in China and in Korea. And I do find that sometimes it's a little bit too aggressive and you could lose fat pockets there with that, just like this patient, it happened with her. So we sometimes solve it with something like a dilute Radiesse. I actually had a patient, she was an older patient, and she was actually, she's 80 something now. When I treated her, I think probably about 6 years ago or so, and she had gotten Dermage at the time, I think also Altera, and she's actually of Japanese origin, and she ended up losing quite a bit of volume. She's 80, and now she's 80. I think she was like in her late 70s at that time, and it was like, really not a good option for her. It was not fair to her. She lost a lot of volume. I actually did dilute Radiesse for her. I did it a couple of times, and to this day, I still see her. Sometimes she comes in for a little bit of Botox, and it looks awesome. So it's you get to keep a lot of that skin there. So dilute Radiesse. It's basically a calcium product. You place it into the skin, slowly the tissue expands. It's a really, really nice product, actually. Really, really wonderful, elegant product. I like it because you could tighten some of the skin. Colleen is saying, will you be able to do quick consultation here on the live? Yeah, what's going on with you? It's not a consultation, but we could give you an idea, a general idea. Let's see here. Um, Kalina saying, hi doctor, how come your procedures aren't going viral in other states? What do you mean by that, going viral in other states? Let's see here. Kay is saying, my face is extremely textured and I hate, how can I fix this please? Easiest thing to do is start with something with like a retinoid. Topical retinoid is one of the best options there for you. So start with something, you know, a tretinoin, or if you just want something over the counter, different works okay. Lasers are awesome though, honestly. Texture lasers are amazing. Nothing's gonna beat it. Nothing even comes close to it. It's so good. Let's see here. Have you ever flattened a small keloid permanently? Yeah, I mean, multiple times. Actually, my wife, she had a keloid. I just like, it was itching her. I flattened it. It's gone for years. And so yes, absolutely. Let's see here. Do you prefer Xeomin or Botox? I prefer Dysport, honestly. Dysport is like my go-to. I really do prefer it. I had lip filler done in September. Is it normal to still have lumps? You may have to massage it. Let's take a look and see. I'm not sure exactly if you, or you should go to the person who injected, I should say, and take a look and see if they should tell you to massage it or not. Sometimes just massaging it will help. Sometimes you have to take a little bit of that bubble down with a little bit of Hyaluronic. It depends on what's happening there. Let's see here. Do you have filler in? Yes, I have filler in. I am a big believer in filler. I just think there's a way to do it, and it's unfortunately that not done with the right product and the right way a lot of times. Sparkly saying, can Botox help with turkey neck? Recently lost weight and I have some loose skin. Yeah, it could help. Definitely a short-term fix. You're probably going to need other options, likely really a surgical neck lift, really. But also face tight, neck tight, those all things could potentially help with you. Let's see here. Again, great questions, by the way. Love the interaction. A lot of really great questions. So I'm happy to help you guys. Just feel free. Don't feel frustrated if I miss your question. I'll try to reach out back to you again, but just ask it again. I'll try to hit it again. Let's see here. I know it's on multiple platforms, so I'm trying to get multiple different platforms at the same time as questions. So if I miss you just for a moment, just bear with me here. I see here, Elvira saying, what do you do for under eye hollow? So filler, you could do actually it, but I do it usually is deep down to the bone. I use like a little tiny BD needle or like an insulin needle, and then use a product that's easy to dissolve. Usually my go-to is Restylane Classic. I love it. It's really, really great for that area. You can also use something Belotero. I like Belotero, but it just doesn't last, I find, as long as Restylane Classic. Sajora is saying, what do you recommend for PIH from electrolysis on Middle Eastern skin? Would clear and brilliant work? I don't think so. I think that'll be that may potentially cause more rebound pigmentation. The Pico laser works really well. I help with that all the time. Renat is asking, downtime of fat transfer. It's about 1 week, but most of it is really within the first couple of days, honestly. It's really pretty mild. It's some swelling for that first couple of days, but it's really not terrible. Snowflake's asking, can dilute Radiesse be mixed with Sculptra when already done? Many docs say not safe. So you're saying that you did Sculptra already and now you're going to do Radiesse? Yeah, absolutely, you could do that. I actually am not a big believer in mixing filler, just like Radiesse with Sculptra per se, especially as a volumizer. I think it'll be a little bit, potentially, you could now run into areas where you could get a little bit more of some lumps or bumps. I just don't find that there's really much of a utility for us. I don't know why I would do it that way. Instead, just kind of going more patiently, just putting one product in at one time, another time. That's totally fine. What do you think of lip fat transfer instead of lip filler? Honestly, I've never really seen anybody have amazing lip filler with fat. It's not an area that you typically would want to put fat in there. The fat doesn't really hold as well there, so it wouldn't really help with that. Sailor Moon saying, I watched Dr. Qazi's YouTube videos and realized that he is next level. Appreciate you, Sailor Moon. Appreciate you. We do actually spend a long time with doing YouTube videos, or just videos in general. So appreciate all the feedback. If you want to see other treatments, we'll try to do it. Some platforms don't let us show everything, but we're happy to show what we can. I love that. Kalina is saying, how come your acne scar Pico laser treatments are not going viral in other states like Texas, etc.? Well, a lot of our patients are from Texas. I think it's just, this requires a very, very different way of doing things than people expect. It's just not what, people just sort of think that there's like a laser that you throw at somebody, there's you're doing subcision. I've done subcision multiple times on people who have done subcision elsewhere, and there's so much scar tissue that's still inside of there that was just left behind. And there's a way to do this that's, that really is very difficult for people to reproduce. I think that it's not just a matter of like skill. A lot of it's also patience, and also a lot of times it's willpower, honestly. And to be totally frank, it's like I really have a hard time meeting people with my amount of willpower when it comes to like anything. When I'm like determined to do something, I will just do it and do it and do it and do it and do it. Even when I think I'm done, I'm just gonna keep on double checking and see if it's done, and then like that's how I push through. So I don't know. It's really tough to find that, really. I mean, I've searched myself before in a long time, and it was like people that I thought were the top people, like plastic surgeons, dermatologists, and it's like really like cookie cutter type approaches that people do. And everybody else wants to sell you like a package for scars, and like they clearly don't understand scars when they sell packages. They don't. Like it's just like to me it's just a huge red flag. And anyone says, oh, you need like 3, you need 6 sessions of like, you know, the CO2 laser and blah blah blah, it's just made up. I don't know what they're talking about. I do this all day long, and some people it's like 2, some people it's like maybe like 3, but like some people it's 1. I don't know, like sometimes it's the collagen response. I can give an idea, you know, with the thickness of your scar, but like it's certainly, I'm not gonna go sit there and like, oh, you really have to just lock yourself up with 3 sessions with me. I think that's silly. I really think it's really like unethical actually, especially when it's coming to scars, because it's like every single person's scar, as Joey's saying, he's saying everyone's scar is different. Everyone's scar is different. And then everybody's skin type is different. So it's like, and everyone's collagen response is different. So all those things factor in there. So it's like, why, why do we do approach where it's going to be something that's the same for every single person? It doesn't make sense to me. So I don't do it that way. It's like certain things, like, yes, you know, I know pigmentation can take about 6 months. Really, I want to suppress pigmentation for those 6 months. Those things I factor in there. But it's like, it's about like that length of time necessarily, not like the amount of sessions per se, if that makes sense. You know, it's like just there's certain variables within this that I think we should be paying attention to. And sometimes it can take more sessions, sometimes it can take less sessions. I don't know why everybody has to do these packages like that. It just doesn't, you know, I guess just to grab money up front. I get it. Yeah, whatever. I guess I answered my own question there. That's what they were doing. Thank you for sharing your knowledge. Appreciate you, Catherine. Let's see. Molly is saying, what's the best filler for acne scar volume loss? Just not Felifil. It's not allowed in the country that I live. Well, if it's not in your country, then you could try Sculptra. Worked really well. Radiesse works really well. Let's see here. Brandon saying, why did you choose to not pursue dermatology residency? Well, I talked about it a long time before. I've talked about this multiple times actually, that I liked a lot of different things, and one of the things I liked when I was doing med school. First, I was actually trying to do more trauma surgery. Initially, I was actually kind of interested more in the trauma world, and I worked at the burn centers in Cook County, which was like the #1 burn center in America, and then also did trauma surgery over there at Cook County Hospital, and then I actually worked in Thailand. And in Thailand, like this remote hospital, which blew like the work over in honestly in America that I've seen. Like the amount, they were very, very meticulous with what they did. They were incredibly careful with how they treated their patients. In fact, you know, for mobility purposes after burns, they were giving massages, things like that, to help patients move like really, really quickly. It was amazing, actually, amazing stuff that we just weren't doing at all at Cook County, at least at that level. And it was pretty interesting to kind of see that. And I sort of realized that it's, there's very few centers like that were doing burns. So I had to sort of switch out of what I was doing. I did like the medical side of things with burn. I liked the fact that there's a whole bunch of medications. They're incredibly complex patients, huge medication lists. And it was like kind of fun for me, to problem solve. So I thought maybe more medical side of things will be actually more fun for me. So I was like, okay, let me go through more like the medical route. Saving people's lives was pretty cool too. Like it was like, I shouldn't say cool, but like it was like a pretty rewarding type of thing to be able to that you were there, because you were there at that exact moment, in that time, you pushed through and you helped that patient survive, really. Which is pretty amazing. Like it's a really amazing feeling. Like, of course, there's a lot of people you can't save, but then there's a lot of people you save, and it's like, wow, this is actually something that I could do. I could see that I'm very even keeled under like a lot of stress and a lot of tension. And so during COVID situations, I could be able to handle this, and I could be able to get people through this safely and save people's lives if we could. I had a lot of patients, young patients. One patient that was like in his 20s who had done energy drinks and had right there in the ER, I was watching as he's going into a VT accidentally. It's like, here we go, let's go save this guy. And it's like, there we go, let's do it. And it seemed awesome. Like I could do this. And it made sense. So then I was like going on about, and I realized that the system though, when I was actually working in that, was just terrible. And I could go through that another day, but like basically it's like all the people cared about in hospital systems was just discharging early. That's what they cared about. Just like, oh, did you discharge at 10 in the morning? Did you discharge, this patient? And they were like, it's all they cared about. And it was just driving me nuts. They didn't care about like actual medical care. You work up a patient, you take care of a patient really well, you spend a whole week taking care of a patient, and then you sign it off to another person, and then suddenly like the patient like falls apart because they didn't care about the patient. They put the patient on the wrong antibiotics, they put the patient on the wrong heart failure medications, they did a lot of different things. And these are, I'm saying like actually like empirically wrong. I'm not saying like, oh, it's just like the physicians, there's a lot of variables. This is just like empirically, it was just like a wrong option there. Yeah, there's no data to show to justify what their choices were, but those people were still allowed as physicians because they discharged before 10 in the morning. And it's wild, and it was like a wild system. And I was like, I just want something that I could control from start to finish, that's my own, that I know I could do at a very, very high level. And it starts and ends with me really. And my brother-in-law is a dermatologist, and he was like, he doesn't do any lasers really at all. It doesn't do anything with scars at all. It doesn't do anything with scars. Wasn't trained in it. He's like, this is something you could do. Like, you're good with your hands. You could do this. Why don't you get involved with this? Is something that like you should get involved with there. Because I was looking at it like, maybe I should do this. Like, this is something I should do. And so I knew, but because I went to Thailand, that internationally the physicians are excellent. So that's why I decided I'm going to learn like internationally from people and get like pick up skills really quickly from people that weren't obsessed with just lasers and energy devices over here. I like lasers, I love lasers, but like all everybody was talking about over here was just lasers and energy devices. And I knew that there was a lot more involved with scars and especially from burns and all the things I saw, that you have to do more manual work like that. So it's like, that's the whole long journey. And it turns out that vast majority of medical dermatologists really now in this area, I was saying that's vast majority, but many dermatologists in this area refer patients now to us because we do it safely in skin types that are very complex, and we have cases that are very, very difficult for a lot of practices, but we take care of it. We do it really, and we have an exceptionally high track record of making sure that we could do that every night in and night out, or day in and day out, I should say. And on top of it, what's really nice is that I don't have long-term pigmentation issues for anybody, so it's awesome. It feels really good, and I don't make scars worse. It's just like things are very, very consistent with the way we could do it. It's just a slower process sometimes than people might think, but we can get there. It's also, remember, I continue to do things. I continue to work at patients and continue to chip away until we can get that result. I really do. Let's see here. Elvira saying, I was in a fire at 4 years old, have scars on both my legs. Is there anything for old scars? Yeah, absolutely. I will help you with that. I love working on burn scars. That's actually like something I really care about a lot of. So I absolutely can help you. I know I'm wrapping up over here right now, but I'll try to finish a few questions. Yes, Cook County Hospital in Chicago, yes. I was there for a long time, actually, Cook County Hospital in Chicago. It was where I did a ton of my training, and it was just like, it was really useful to me because you could just go in there and like do everything for people. It was awesome. And just, patients were really sick, and I was like, you could do something and make a dent in their world and their lives. It's awesome. Let's see here. Joshua is saying, is there no natural way to restore regained fat after Thermage Altera? Well, you could potentially do a fat transfer. That's another way of doing things. So you could do that. And Sailor Moon saying, thank you for your story. I never cared that you are not a dermatologist. You are more humble and skilled than any derm I've seen. They tell us to do microneedling. Well, I mean, I do think, appreciate you. I do think that there are some that, that do care about this, and a lot that don't do these procedures and refer over to me. I think it's also important just for people, just if they're not, this is not their world, or whatever they're doing is not like they're the expert in, to send people, to send patients to experts. There's a lot of things that I don't do. And if I see a patient that I just, I'm looking at, it's like, this is something I just don't do. It's like, here, you should go see somebody. I sometimes have a name, sometimes I don't, but like if I do, I'll suggest something, and I'll try to honestly just be like really, just be really, really honest with everybody that this is something that I'm just like, I don't do this one, so go forward with it. But the things I do a lot, and probably the most in the country, to be honest with you. To be totally honest with you, potentially some of the things in the world. Like, I do so much of it, and I do it at such a high level, and I just continue to do it, and we can do it, and I'll be able to help you out with it every single day. Let's see, okay, saying one of my glands is very visible after my face and neck lift. Should I be concerned? Well, it depends on how long after it is, after, you know, or I should say how soon after that you're seeing that. And potentially you may have to actually remove some of those glands with like something like an ENT doctor, a facial plastic surgeon could potentially be an option. See, there's an idea, there's something right there. So we don't do gland removal, at least at this point. So Kay's saying 6 months. So actually, for some patient like this that I have seen actually before too, I just say go to a facial plastic surgeon for that. There's facial plastic surgeons that will be able to help you with that. Sarah is saying, I came late. Does filler eventually dissolve? If it's superficial, probably not so much, honestly. Probably going to continue to be there. It's been there for at least 12 years for some patients, sometimes even longer. It's tough to say whether or not they really do truly dissolve. Anyways, guys, I appreciate you. Mario is the last person that he wants to answer. He wants me really badly to answer the question. Mario, where is your question? This is the last question. Let's see. Mario's question. Where is Mario's question? I'm scrolling up. Mario, can you just repeat the question? Because it looks like there's like 100 questions before your question here. So you are asking a few times. Can you repeat the question so I could answer the question? But just repeat it, and I'll be able to help you out right now. Let's see, Mario. Last question. We're way overboard here, so just feel free to ask. And remember, I'm on again tomorrow night. So if you miss me right now, I'll be on again like Monday through Thursday at 9 p.m. Mario, I'm losing you, Mario. And okay, I am out. Okay, guys, I appreciate you. I will answer. I saw a few of you guys asking more questions. And let me answer this one last thing. Your mom is saying, I want to try Dysport, but I read that you would need more units than you would need with Botox. The way we do it is basically exactly the same. We do the exact same units for Botox, Xeomin, Dysport. It's all the same. So you don't have to worry about the number of units. It's just the same amount. All right, guys, appreciate you so much. I will see you again tomorrow night.